I'm honored and ecstatic to receive the RNAO Media Award for my news story. I really appreciate this award because I think my younger self would be very happy. When I was 15, I wanted to become a journalist, and although my career took a different path when I turned 30, I ended up working for David Burkitt at the Voice of Pelham as kind of a side job, and that's how I ended up covering this story. This story is very important to me because it sheds a lot of awareness on how important nurses are as frontline workers during and even before the pandemic. And I hope this award brings even more awareness to the fact that they need extra support and fair pay. I would like to thank my parents, my mentor Kim Yallop, and my editor David Burkitt. Without their support and guidance, I wouldn't be where I was today.
On behalf of myself and my colleagues, we would like to extend our deepest gratitude to the Registered Nurses Association of Ontario for this great honor. The toxic drug supply is something that has affected Canadians from coast to coast to coast. We're also humbled because it is part of a new model that we're building at the Investigative Journalism Bureau. This story was a collaboration between ourselves and the Centre on Drug Policy Evaluation. This partnership allowed us to tell this story in a new and exciting way, which we think had tremendous impact. So again, thank you very much for this great honor, and congratulations to all the other award winners for your great work over the last year.
I just want to take a couple minutes and say thank you so much for this award. It's very much appreciated. But more importantly, thanks to all the nurses in this country who've been a rock for us the last couple of years in the face of some pretty tremendous adversity. I'm a kid of two doctors. I grew up around nurses most of my childhood, so probably more than most, I appreciate all the things that you do for us. So I would love to say thank you very much for that, and thanks for this award.
Winning this award is an affirmation that the work I am doing is both important and helping change the narrative. I am honored to receive this recognition from such a strong and credible organization like RNAO, one that believes in and advocates for better public policy. The piece that I submitted for this award takes a close look at how healthcare professionals, including nurses, are struggling to cope with an unprecedented number of drug overdoses at supervised consumption sites in Toronto. It also highlights how Canada's massive drug poisoning crisis has been exacerbated by the COVID-19 pandemic. I am passionate and dedicated to reporting on social justice issues and believe my work on these important topics is making a difference. Thank you so much for this award.
We just wanted to extend our deep gratitude to the RNAO for recognizing us with this award. This story was months in the making, and so having this acknowledgement from you, and especially from a medical health body, to acknowledge the months of work that went into this project is deeply meaningful, and so we thank you.
COVID-19 exposed longstanding systemic issues, not just in Canada's healthcare system, but in the long-term care system, long-term care systems across the country. And this story focused on one long-term care facility in Ontario. It was the deadliest outbreak of COVID-19, and it exposed massive issues, not just with this home, but with the way the province handled the response to COVID-19 with some of the most vulnerable citizens. And we just want to thank the families who spoke with us, the families who lost loved ones, workers inside the home who risked their jobs to speak with us, and also public health officials who also spoke with us for this story. It was incredible, and we just want to thank you.
I just want to say thank you for the award for my radio documentary, Abiola, Temi, and Sophie. I was able to produce this through CBC Radio's Doc Mentorship Program. Shout out to my mentor, Jeff Goods from White Coat Black Art.
I had a patient and I said, "Hey, mister, I'm going to take your blood pressure." And he just kind of started resisting, like moving his arms almost like away from me. He said, "Oh, you black trash people are back again."
The story was such an important one to tell, and I'm really grateful that the nurses that I spoke with were willing to share their story so honestly, because it really helped to paint a picture of what they're experiencing on the front lines. But also, other nurses reached out with their stories, and it became this issue that, even the RNAO went on to address. So thank you so much for addressing this story and highlighting it and for honoring it in this way.
Reporting throughout the pandemic has been both challenging and eye-opening. What a privilege it's been to have several opportunities to be on the front lines with our healthcare heroes, including registered nurses and nurse practitioners.
My patient was very young, in her 40s, and she passed away of COVID. And it was like, we felt so helpless because we were doing everything we can and it still wasn't enough.
Thank you for honoring my work. Thank you for everything that you do every day despite the often difficult circumstances. I'll continue to tell the stories.